Antibiotic prophylaxis in dental practice is not for every patient and not for every procedure. Its purpose is to reduce the risk of serious infection in a small group of patients who are especially vulnerable to bacteremia from dental treatment. The key principle is simple. Use antibiotics only when the benefit clearly outweighs the risk. The most important indication is prevention of infective endocarditis in selected high-risk cardiac patients. This includes patients with prosthetic heart valves, a previous history of infective endocarditis, certain congenital heart diseases, and cardiac transplant recipients who develop valvulopathy. For these patients, prophylaxis is considered before dental procedures that involve invasiveness, such as manipulation of gingival tissue, the periapical region of teeth, or perforation of oral mucosa. Routine prophylaxis is not recommended for most other cardiac conditions, such as common murmurs, mitral valve prolapse, or uncomplicated congenital defects. It is also not indicated simply because a patient has a joint replacement, unless there are special circumstances and advice from the treating physician. Caution to consider are patients with penicillin allergy. The exact drug and dose should follow the current local or national guideline. If the patient cannot take oral medication, an appropriate parenteral option may be used. It is important to remember that antibiotic prophylaxis does not replace proper clinical technique. Atraumatic treatment, infection control, drainage when needed, and definitive dental care remain essential. Overuse of antibiotics can lead to allergy, gastrointestinal side effects, Clostridioides difficile infection, and antimicrobial resistance, so prescribing should always be justified. In practice, the decision should be made by assessing three things: the patient's medical history, the type of dental procedure, and the current guideline. If there is any doubt about the medical condition, consult the patient's provider. Be specific with clear documentation of what is information needed, and not just ask for clearance. Instruct patient clearly about the indication, drug, dose, and timing is also important. The bottom line is this: antibiotic prophylaxis in dentistry is a targeted preventive measure, not a routine habit. Use it selectively, use it correctly, and always keep patient safety and antimicrobial stewardship in mind.